All right, everybody. Good afternoon. How are you? Welcome to the call. My name is TR McManus, and today I'm going to be the person actually going through and presenting this. I'm one of the founders of Infinity Regenerative Medicine, and today we're going to be talking about stem cell therapy, what stem cells are, and how they may be able to help you or a loved one with a condition that you'd like to get rid of. Now, how this will work, since we have many, many people on the call today, and they're coming from different doctors who have referred them or different people that have brought them in or different ways they heard about it. This call will be where we don't have the ability to necessarily answer questions, or even like if you're going to try to ask a question while I'm talking, I don't really have the way to kind of do both. So here's what will happen. If after the call you want to know more, hopefully you got it scheduled with the doctor's office who referred you a follow-up call. If not, we'll actually be able to show you how you can reach out and schedule a personal call to answer all your questions. So what I want you to do is get out a paper and a pen, if you can, take notes as well as write down questions that you have. I will give you, like I said, by the end of the webinar, a way to be able to ask questions and really understand what it is we do and how it might be able to help you. So once again, welcome to the call, TR McManus. I'm going to spend this webinar is going to be very, very educational. The purpose is to really dive deeply into regenerative medicine, into stem cells, what they are and how they work. I hope you find it beneficial, and I look forward to talking to you potentially later on after this call. I am currently talking to you from South America. I'm actually flying back to the States today, but I am talking to you from South America today. And we have what's considered, or what we consider to be the most advanced stem cell therapy in the world. And I'm going to kind of go through why we feel that we really have that type of high level of stem cell therapy. So I want to start out by first getting into what stem cells are and actually how they work. There's a couple different types of regenerative medicine that we use. One of them is stem cells. The other is platelet-rich plasma, or PRP. We usually use platelet-rich plasma only in conjunction with stem cells. And we only use PRP, which we get from the patient's own body, which is growth factors. And we use it only when we're doing injections like intra-articular, let's say into a knee or a shoulder or a hip, or for plantar fasciitis. Some people who come down for hair replacement, hair regrowth, as well as cosmetic procedures. Other than that, the other type of our most common type of regenerative medicine is actually stem cell therapy. We use stem cell therapy, like I was saying, for these orthopedic type applications, for bad knees, bad shoulders, bad hips. Sometimes when people have bad discs or spine problems. We use it for cosmetic and aesthetic applications for reducing wrinkles. People where they maybe have some different kind of sunspots or kind of scars on their face, or cosmetically they'd like to be reduced. But primarily we use it for IV therapy application. What we mean by that is we have the ability to put in large doses of these stem cells that we're going to learn about into the veins so they can travel throughout your body and help people with different conditions that they're dealing with. Conditions like Parkinson's, conditions like multiple sclerosis, conditions like cerebral palsy and autism, heart failure, kidney and lung problems, over 80 different autoimmune diseases, and many, many other things. And that we usually do IV. But first, let's talk about what is regenerative medicine. What is it, and what is it designed to do, and what's the logic behind it? Regenerative medicine is a field of healthcare and as well as research that deals with the process of replacing or engineering, regenerating human tissues or cells or organs to get them back to normal function. So the idea is, if you have a problem, or a loved one that you're on this call for has a health issue and they're looking to solve it, our idea with regenerative medicine is fix what's causing that problem so that the problem goes away and stays away. And that's something that's really falls under a type of medicine called corrective care. See, there's a couple different ways that sometimes doctors will choose to treat patients, and there's a couple different ways where patients might opt for different treatments that fall under two different logics. The first logic is corrective care, and the second is relief. Relief care is also sometimes called pain care, and it can also be kind of called emergency care. And the idea with relief care is to lower the pain or lower the symptoms or the effects from whatever the problem was. So if you had an accident or an injury and you were in a whole bunch of pain, doctors might give you a anti-inflammatory, some muscle relaxers, painkillers to lower the pain. And then they do that so that the patients won't suffer. They also might use over-the-counter medications, right? So this is where people, the logic behind it is, let's get the patient out of pain. It doesn't mean that we're going to address what the issue is, what's causing the problem, or what caused the problem, or what started the disease. We're just going to try to make it so that the patient can cope with the problem, they can deal with it, and they're not suffering. So sometimes they use prescription medications, over-the-counter medications, and in a lot of cases are able to use different types of injections. Now, in relief care, in emergency care, in this pain care, remember, it's not designed to fix the problem. It's designed to be a short-term thing where you can get out of pain and look for a more permanent type of solution. And so that's really what corrective care is. The logic or the philosophy behind corrective care is, if you have a problem, let's fix what's causing the problem. And if we can fix what's causing the problem, then pain can go down, stay down, and function can return. And what function return means is you basically get your life back, hopefully like it was before, right? Before you had the actual issue itself. Now, stem cell therapy, the stuff we're about to talk to, stem cell treatments, is designed to fix what's broken so that there is no more symptoms or there's no more effects. And if we can fix what's broken, we can we can stop those effects from happening. So basically, stem cell therapy is really designed to be a corrective care type of treatment. So now let's talk about what are stem cells. Stem cells are what's called neutral cells or undifferentiated cells. These are cells that have not been changed into anything else. Now, the unique thing that makes a cell a stem cell is they have the ability to make more stem cells, meaning they have the ability to make more of these neutral cells. And they have the ability to then turn into other types of cells. So if your body needs more muscle cells because of an accident or injury, then they can actually make more stem cells, but then they can also make more cells that can become muscle cells. And that's what makes a stem cell, the ability to be neutral, make more of themselves, and make more of other types of cells that the patient needs so they can get better. So doctors can use stem cells to help patients repair any problems, damaged tissues, diseases, damaged organs, etc. Now, there are different types of stem cells. What I want to first get into and make very clear the types of stem cells we do not use. I want to clear the air on that and get really into the types of stem cells we do not use. We do not use embryonic or fetal stem cells. So once again, we do not use embryonic or fetal stem cells. Embryonic, fetal, and fetal stem cells are, of course, for cells that came from embryo would be from embryonic would be from the embryo, and from a fetal stem cell, of course, would have came from an aborted fetus. In harvesting stem cells from the embryo, you would actually terminate the embryos, and as well as, of course, you'd have to get fetal stem cells from an aborted fetus. And there is huge moral and ethical implications with these types of cells. Like the Catholic Church and many different groups were completely opposed for the use of these types of cells in scientific studies as well as patient application. Now, the other thing is there's legal reasons. Legally, we cannot use these cells here in South America, in Colombia, where I'm at today, nor are we able to use them in the United States. So we don't use them for moral and ethical reasons, and we don't use them for legal reasons. And one of the most important things as well is the medical and the scientific reasons that we do not use these stem cells. Embryonic stem cells and fetal stem cells are considered pluripotent stem cells. Pluripotent means they have the ability to change or differentiate. Remember, they can make more neutral cells and they can change into other types of tissue. So they can basically turn into almost every single type of tissue or cell in your body. We have over 200 different types of cells in our body. the embryo and the fetus is trying to develop and become a fully developed little human, an infant, a baby, right? So they need to be able to be flexible and be able to turn into all these different types of tissues. Here was the problem with that. Now, when you think about that, you're like, well, that makes sense. That's the kind I would want. And that's what medical doctors and scientists first thought when the research began. These are the cells that we should use. But they ran into some problems, not just the moral and the ethical problems, but they ran into medical or scientific problems as well. And that was when you would put these cells inside a person. So they become donated and into a recipient, somebody would receive them. The immune system would actually attack the cells. So your immune system, we're going to talk a lot today about the immune system, is something that's super important. Your immune system is actually there to help protect you from invaders, outside forces, and also protect you from things that are happening inside of your body, like cancer, like viruses, like bacteria, parasites. It's designed to help protect you from outside as well as internal factors. When these cells would be introduced, your immune system would look at them like foreign invaders and actually would attack them. And because of that, doctors, to try to get the patient the care and the help that they were looking for from these stem cells, they would have to lower the immune response. They'd have to make it so that the immune system couldn't react and couldn't try to kill those cells that they were putting in. Now, here is the problem with that. When you lower somebody's ability for its immune system to respond, you open the door for problems, right? The ability for bacteria, viruses, parasites, other things to kind of run wild or be able to get in. But also, we all as humans and adults have multiple types of cancer in our body at any given time. And the problem with that, one of the jobs, remember, of our immune system is to find things that are dangerous to us inside of our body. When it runs into a cancer cell, its job is to remove it or to kill it or to destroy it. And if we make it so that the immune system can't respond, it opens up the door to a lot of problems. The other issue is our immune system actually is not just a defender and protector of our bodies. It actually is also designed to really be part of the healing process, which we're going to talk about more. So in leaving this idea or subject of the cells we do not use embryonic and fetal cells for moral, ethical reasons, as legal reasons, and medical reasons as well. Now I want to get into and talk about what are the types of stem cells that we do use. These are what we are actually currently doing. We are currently working with something called mesenchymal stem cells. They're often referred to as MSCs. Now, MSCs, or mesenchymal stem cells, are actually considered an adult stem cell. They're considered an adult stem cell because where we get ours are from something called the Wharton's jelly. The Wharton's jelly is a gelatinous substance, and it wraps around the umbilical cord during pregnancy to protect the umbilical cord. And inside of this Wharton's jelly are these mesenchymal stem cells. And we get ours from donated umbilical cords where we can take and pull out these mesenchymal stem cells from the umbilical cord. Remember, one of our requirements is it has to be a normal, healthy birth, meaning there cannot be any problems, and the baby and the mother both have to be fine. So this was, which at one time was considered medical waste, has been found to be a gold mine where we have all of these really great mesenchymal stem cells that we can actually get access to, all from a live, healthy birth. This has been a very, very promising field. And now, instead of the Catholic Church attacking stem cell therapy, they're actually supporting it. Every 2 years, the Vatican hosts a conference bringing the greatest minds of stem cell therapy and regenerative medicine and things like this to the Vatican to have a huge conference to further the research. So now, from being completely against it, now they're a huge supporter of it. And that's because these are considered adult stem cells. And it's also the opportunity that these things have to do with healing. See, mesenchymal stem cells, not only are they adult stem cells, they're also what's called multipotent. And multipotent means they have the ability to turn into or change into only a few different types of cells. So they can't turn into or potentiate the growth of just any cell. It's a selective type of cell. That's the only thing that they can do. And the good thing is they're considered non-tumorigenic. They're actually considered to be, they're actually considered to be non-tumorigenic, where they're not known to form nor cause cancer. They do not form or cause cancer. Non-tumorigenic, very important thing. The other thing that they are able to do is actually work with the immune system instead of against the immune system. See, the immune system does not attack these cells. The immune system these actually work with your immune system. They're what's called immunoprivileged. They have the ability to stay in your body without the immune system attacking them. So one, they're adult stem cells from a live, healthy birth. Two, they're multipotent, and they cannot get into multiple different types of cells, only the types of cells we want to work with. Three, they're actually immunoprivileged. They can actually be in our body without our body having to try to attack it, so that our cells don't, so that we don't have to worry about lowering the immune response. And our bodies not only do our bodies not reject them, our bodies actually have the ability to actually support and work with them. There's many things that these stem cells do, these type of stem cells, but I want to cover 4 of them that are very, very important. The first is they have the ability to reduce inflammation. Inflammation is not our friend, especially chronic inflammation is not our friend. Chronic inflammation has the ability to help lower the risk for cancer. Lowering chronic inflammation has the ability to lower pain, and getting rid of chronic inflammation has the ability to stop the acceleration of aging process as well as damaging tissue. See, chronic inflammation, if you were to Google chronic inflammation and cancer, you'd find that cancer.gov, like cancer.government, would pop up, and it would say that chronic inflammation leads to the destruction of DNA or the damage of DNA, which can cause many types of cancer. It would also talk about how it can cause aging to be accelerated, as well as is considered one of the effects of a lot of different diseases like autism, like most inflammatory diseases, like autoimmune diseases, etc. So when we can lower inflammation, we can lower pain. Where there's chronic inflammation, there's usually chronic pain. When we can lower inflammation, we can lower pain. When we can lower chronic inflammation, we can lower the chance of DNA being damaged and the possibility of cancer. When we can lower inflammation, we can actually slow down or stop the actually degeneration of the tissue where it's at, as well as the tissue around it, and slow down aging. The second thing, now these are the great thing about these mesenchymal stem cells, they actually don't get rejected by the immune system. They actually work with the immune system. So they actually have the ability to modulate your immune system. And what does that mean? Sometimes our immune system is not working like it should be. It's not working well. And that could be to a lot of different factors. One of them, believe it or not, is aging. As we age, our immune system doesn't work like it should. But our immune system, as it's not working well, we become more exposed to things like bacteria, parasites, viruses, right? Like COVID. We also become more susceptible to things like cancer because it can't keep up with the demand when it's not functioning right. Now, there's times when an immune system will overact or overfunction, or there's a time where the defenders of our bodies from threats outside and inside the body actually turns and attacks the tissue that's supposed to be protecting. It actually attacks the tissue it's supposed to be protecting. And that's where you usually get autoimmune diseases that come in. So the great thing about our stem cells is they have the ability to actually work with the immune system. And when they need to bring it up and help in things like viruses and colds and flus, it can. And things like autoimmune diseases where it's overreacting or not functioning correctly, it can actually lower it or make it so that it stops doing that. Now, the third thing, anytime we have injuries, accidents, falls, operations, bad diseases, or whatever else, sometimes when our body gets damaged, we have the formation of scar tissue. And to truly have a full healing, we have to get rid of scar tissue in our body. And these cells have the ability to prevent scar tissue and the ability to actually help remove scar tissue. Now, for people who come down for cardiac reasons, let's say they had a heart attack and they had this, then during that event, there was some scar tissue on the heart. Well, one of the reasons the heart can't properly work good or cannot properly repair could be the heart, the actual tissue damage, the fibrotic tissue, the scar tissue that happened during the event. And if we can actually get these mesenchymal stem cells, and this is all backed by scientific studies, if we can get the stem cells to be able to prevent further scar tissue and remove the scar tissue that's there, and then move into the fourth thing they do, which is the helping generate or regenerate, now we can get that heart back to how it was before the event. And this is something that's extremely important. So these four of the important things that they do, but these cells do tons of more stuff. So mesenchymal stem cells are the type that we use. Now, here's the deal. When we're born, we basically get an inheritance of these stem cells. We have the most stem cells we're ever going to get is the day that we're born. We have our biggest inheritance. And they're in there. What I mean by that is they're in their highest concentration. They also, every second of every minute of every hour of every day, we're starting to have cells that are naturally dying in our body, as well as sometimes we have accidents, injuries, operations, problems. Every time we do that, we actually start to use up cells. See, cells we not only have to use stem cells to replace things when we have accidents, injuries, slips or falls or diseases, we also have to use stem cells just to maintain our life. And what I mean by that is every second, as an example, we lose 15 million blood cells. And thank goodness we have stem cells that inside of our bloodstream and inside our bone marrow that can actually help these blood cells replace themselves. So just for me to be able to say every second we lose like 15 million cells in our body, we all lost about 100 million blood cells, but they got replaced. Now, if we didn't have these stem cells, the problem is our blood wouldn't be able to be replaced, and that would be a bad problem for us. We naturally lose cells every single day. Our stem cells in our body have the ability to make new cells. Remember, they can divide and make more stem cells, and they can divide and make other tissues to make it so that we can maintain our life. We also use them when we have these accidents, injuries, slips, and falls. Now, because of all of this, there's a medical term called stem cell exhaustion. And stem cell exhaustion, as it basically explains, is one of the hallmarks of aging. And that's basically it. Stem cell exhaustion is an age-related deficiency of stem cells, meaning as we get older, we have less stem cells. Remember, we're constantly using them and we're constantly losing them. Every single minute, every single second of every single minute of every single hour of every single day, we're using these things up. We also use them when we get injured. So stem cell exhaustion is a serious, serious thing that really is known to lead to aging. And is also because of aging, it happens. It's like this catch-22. There's really a three-pronged part of stem cell exhaustion. One is the decrease, as the numbers of cells decrease as we get older, because we're using them, etc. That's part of the exhaustive process. We have less of these cells. The rate of proliferation. Well, what does that mean? That means how fast that one stem cell can make another stem cell. How fast can one stem cell make another stem cell is what the rate of proliferation is. And also the third part of this prong is how many growth factors, proteins, cytokines, growth factors, elastin, molecules, how much of these building supplies that our bodies need can these stem cells actually produce? So how many they can actually produce is basically how much they produce. And as we get older, we have less of them. As we get older, they slow down, just like our bodies slow down. And as we get older, they actually have the ability to produce less building blocks. So let's look at a study that came from a Dr. Kaplan. And he actually found that when we're born, we have this highest concentration. It's about one of these mesenchymal stem cells for every 10,000 other types of cells in our body. That means we have a very high concentration. As the other thing about these stem cells when we're born, they're at their fastest. And what does that mean? They have the ability to actually go from one cell and in 31 days produce 1 billion cells. So one cell can become 1 billion cells in 31 days. That's a big number. So there's a lot of them and they're fast. The second thing is they're also, when we're born, they have the highest ability, the highest potential to produce the most types of things that we need when we have to rebuild, replace, and repair tissue that's damaged or we lose. So they're at their highest potential to make the supplies, the building supplies that our bodies need when we're born. Now, this is important because remember, when we're born, we're a small 6, 7, 8 pound baby. We have to become full grown. And it takes a lot of our regenerative medicine inheritance, right, to grow our bodies, to fix our bodies and maintain our bodies in those first 20 years or so. By the time that we reach our skeletal maturity in our late teens or our early 20s, we usually have used up about 90% of the concentration of the stem cells we have. And instead of having one of these cells for every 10,000 cells, it's more like one of these cells for every 100,000 cells. So you can see the concentration of these cells is greatly reduced. Now, remember, these cells not only fix things when they're broken or replace things, they also replace things as we lose them. There's this natural constant replacement or building of and rebuilding of tissue. What most people don't realize, everybody on this call, we have all had stem cell therapy. We have it every single day. Every time that you've been injured and been fixed, you've had stem cell therapy. Every time that you have a cell that dies and gets replaced, you've had stem cell therapy. It's not new to us. The problem is, as we get older, we have less of them. As we get older, they slow down. By the time we get to be in our late teens, our early 20s, we've reached our skeletal maturity, we're not growing, we're down to dealing with only 10% of what we started with, and we're in the first phase of our life. So this is one of the whole things that happens with this stem cell exhaustion. Now, by the time we reach age 50, we end up having more like one stem cell for every 400,000 cells in our body. So we have one stem cell for every 400,000 cells in our body. Remember, when we started, we had one for every 10,000. That means that we have 40% less as far as the percentage or concentration in our body than we had when we were born. We have 40 times less ability to heal ourselves when we're hurt, to fix ourselves when we're sick, and we have 40 times less ability to actually even maintain life as we have natural cell death and they have to be replaced. Now, by the time that we reach age 65, and it now takes around 60 hours for one cell to become another cell. And at that rate, instead of one cell being able to produce 1 billion cells in 31 days, they can only produce around 400. Now, to put that into perspective, if you were going to count to 400, it would only take you a few minutes. And if every time that 1, 2, 3, if every number was a second, it would take you only a few minutes. If you were going to count to 1 billion, it's literally thousands of years. That's the difference. A couple of minutes versus a couple thousand. That's the magnitude of what a cell can produce when it's young compared to what a cell can produce as it gets older. So let's look at the effects of this stem cell exhaustion over a 90-year lifespan. We'll break this lifespan into 3 trimesters. The first trimester, the first part of it will be the first 30 years. Now, in the first 30 years, we don't really have much aging, and more, we have generation. Remember, we have to build our body. So not only do we build our body, but we don't really have much aging. Our regenerative abilities is in its highest phase. Our cells are fast. We have a lot of them, and they can produce a lot. By the time we get into the second trimester, ages 31 to 60, we really start to see the effects of aging. We start to see gray hair. We start to see wrinkles. We start to have aches and pains. We physically actually slow down, meaning we're not able to run as fast. We're not able to lift as much weights in the gym. We're not able to recover when we get sick or have an injury. And this becomes normal. We're just slowing down. And we go, oh, yeah, well, we're getting older, right? Now, the third trimester, this is where we really see the aging process accelerate. We see faster and faster and more degeneration. So the degeneration speeds up and the body slows down. So we get that we have more degeneration, but our bodies slow down. Now, here's the deal. We can see aging happening on the outside. We can see the gray hair. We can see the wrinkles. We can see the sunspots and all of these types of things. We can see people hunched over. We can see them walking slower. We can see them not able to be as agile as they were before. Now, remember, we can see that because it's on the outside. What we can't see what's happening on the inside. What's happening on the outside is happening on the inside. We can't see it. We definitely can feel it. We feel the effects. The bottom line is with stem cell exhaustion is when we're born, we have a lot of these mesenchymal stem cells, and we have the ability to grow, rebuild, replace, and maintain, and we don't really have even aging. As we age and we get older and older and older, we start to have less of these stem cells, and aging starts to happen. And when we have too few of these things, guess what? Unfortunately, we're not even able to maintain our lives, and we move towards an end-of-life event. So here's the deal. When we're born, we have such this big inheritance of these stem cells that we have more ability to generate and regenerate tissue than we have of properties of degeneration, meaning a cell dies, no problem, we can replace it. At some time, as the stem cell exhaustion continues to happen and it becomes more and more of a thing in our life, at some point, we start to have more areas or properties of degeneration than we have the ability to regenerate. And at that point, we're fully in this stem cell exhaustion. And you can see it, and you know it happens when you start to see the effects of aging. So if you're seeing the gray hairs, all of that stuff, that's everything that we're kind of talking about. So now that we've talked about what stem cells are, how they work, and what they can do, I want to be able to talk to you now really quick for the next few minutes on what we're able to do and how we're able to do it here in South America. I made a pretty big claim that we feel like we have some of the most advanced stem cell therapy in the world, and now I want to kind of go through that. I'm here today, like I was saying, in the country of Colombia, where, believe it or not, we have an unbelievable state-of-the-art laboratory and medical center. I want to introduce you to our medical team, or this is just part of our medical team. Dr. Julieta is a tenured medical professor at the university. She's also a teaching doctor. She's also a medical geneticist, which is a really big deal in this arena. So it gives us a huge advantage over other labs around the world. She's also put our lab together, and she's the laboratory director, and she specializes in stem cell therapy and regenerative medicine. Dr. Carlos Izaza is a medical pharmacologist. He's also a licensed tenured university medical professor, and he's also an author. If you studied medicine in Spanish, you read his book. He literally wrote the book on medical pharmacology, and it's in its like 7th printing. He's also the director of scientific research for our lab, and every day his job is to look at the most updated studies and everything to make sure that we always have the most state-of-the-art type of treatments and protocols. Dr. Samuel is actually a university professor. He's been teaching at the medical university for over 21 years, and he's actually the professor of anatomy. He's also one of our treating doctors, and if you were going to get an intra-articular type of application, a cosmetic or a hair replacement, he'd be the guy that would be doing it. And then there's Dr. Natalia. Dr. Natalia is our medical coordinator and director, and her job is to help coordinate and direct things, and she's also one of our treating physicians. And her job is to help line everything up. You'll meet all of these people probably if you were to come down, but for sure, Dr. Samuel, Dr. Carlos, and Dr. Natalia, who are also always in our medical center as well. Now, we're able to do things different here in Colombia than we are actually to do it in the States. And that's just because it's not because medical doctors don't have a desire for it, or scientists don't have a desire for it, our laboratories don't have a desire for it. They're just basically limited because of regulatory reasons. We also are very regulated here in Colombia, and we have something called the INVIMA, like is comparable to the FDA. The difference is the FDA says their position is that if you have this Wharton's jelly, like we use, and you were to pull a cell out of it, even though you have this natural substance and you're taking a natural cell out of it, you've now manipulated the tissue, and anything that's been manipulated, they classify as a drug. 100% natural, you're just taking part of it out, and now it's considered a drug. So with that, they're saying that you have to go for drug approval. The problem for drug approval is, one, this is a natural substance. You can't patent a stem cell. We all have them. No company can patent it, so they couldn't really own it. The second thing, then it would take 10 years of studies and usually $800 million to $1 billion to be able to get that done. And that would be for one disease state. So we could get it approved for Parkinson's. Now we want to treat somebody with multiple sclerosis, would have to go for that approval. And since it's not patentable, you can't patent a natural substance, nobody's going to ever go for that. So, but in Colombia, we're actually able to isolate, so we can pull out of this natural substance, this Wharton's jelly, we can pull it out, these mesenchymal stem cells out of there, And then we're allowed to do what we're not allowed to do in the States, which is let them do what they do naturally in our bodies. And what they're doing right now in your body is to make more of themselves and make other tissue. So we're actually able to put them into an environment, what we call cultivate and expand these cells to be able to turn into the hundreds of millions that are necessary for an application. Now, the FDA also said that we're not able to use these cells for systemic applications. So we can't put them into the vein. And you wouldn't want to, because the product in the United States is not designed or prepared for that, nor approved for that. But in Colombia, we're actually able to take this 100% natural, 100% pure mesenchymal stem cell based treatment and inject it safely into people's veins, get it throughout the blood system, and get it to the part of the body that they need. To give you a comparison, the average CC maybe in the States has between 1 million and 3 million cells. And that means, let's just put it at an average of 2 million. So that means if you were going to, we know our minimum dose for big diseases like autoimmune and heart problems and Parkinson's and multiple sclerosis, rheumatoid arthritis, all these things, our minimum dose is 150 million. So if it's 150 million, it would take 75 cc's at probably an average cost of $5,000 each. It would take hundreds of thousands of dollars just to produce the number of cells. But the problem is the cells in the United States, they have to cryopreserve them. So these cells have been frozen and they have to be thawed. Our cells are fresh, not frozen. They're alive. They're at the time of application. They've not been frozen and been tried to be reanimated. And we don't make copies of copies of copies. We only have them be like 2 or 3 generations so that they're really pure, great, robust, healthy cells. Now, our first process of quality and safety control is actually different than we know of any other lab around the world. We have one doctor where we get our stem cell cords from, one. Just so you know, also, none of the cords that we use have ever had the mothers were not vaccinated with against COVID. So these are not, they do not have that. If somebody has a risk where I don't want to cord or cells from somebody who's been vaccinated, some of us do, some of us don't care. They have not. So it works for both people. The other thing is that our doctor we work with one gynecologist, one obstetrician, who's also a medical professor and trained in stem cell therapy. And he looks for a young, healthy couple. And the healthy couple is an important thing. In the United States, as an example, last year, more than 1 million women donated their stem cell for medical and scientific use. Their umbilical cords after the birth for medical and scientific use. The difference is it's only the mother's really known, and she's only a part of the equation. For us, we want to know the entire pregnancy, which is controlled by this medical professor, this medical doctor, and who's trained in stem cell therapy. But we also want to know the father. Remember, Dr. Julieta is a medical geneticist. She's like, hey, listen, the father is there in the DNA 50% of the time. I have to be able to know that the father is also healthy. So once the couple in the 7th month is asked, would you like to donate the umbilical cord for medical and scientific use? If they say yes, and they meet all of our first screenings, young, healthy, and a couple, then they're qualified to come into our lab and actually meet with Dr. Julieta, who takes them through testing to find out family history, family genetics, and all of that stuff to make sure, as an example, that there's nothing in the mother's family history that we wouldn't want, or let's say also in the father's. Remember, if there's like Down syndrome is in their family, that would be something that would disallow them to be able to donate their tissue. So this is something that we don't know happens anywhere else in the world. The second thing is we do more tests on this tissue against infectious and communicable diseases than is required in the US on both the mother as well as the actual cord itself. And we do DNA testing before and during and after the cultivation of these cells to make sure that it's what we want. We look at the genome, we look at the DNA, and we look at chromosomes. And we want to make sure that they are safe, healthy, but also robust. And what we mean by robust is their fitness level, their physical characteristics are what we're looking for. No professional team in any sports would blindly draft any athlete without looking at them, understanding that there's somebody they may want to put on their team. And unfortunately, for most laboratories around the world, that's actually what has to happen. We're able to look at the parents, we're able to look at the cord, we're able to then look inside and look at the DNA, and we're able to test it. And when we find the DNA that's safe and the DNA profile that we are looking for, we get to select the professional athletes that we're going to field for the game to try to get our patients better. So we actually get to select what ones we actually use. The other thing that makes us different is we do tests to verify that our product that we're going to be injecting into people for human application is a 100% mesenchymal stem cell product from the Wharton's jelly. And there's actually tests that we do that shows, and that's not just done in our lab, but every lab test that I'm talking about, not only do we not just do in our lab, we have it third-party lab verified. Patients get all of this data before they get treated. When patients come down, they sit down with Dr. Carlos and Dr. Natalia, and they actually show them, here is the DNA profile of your cells. Here is the test that shows that they were clean and of no infectious diseases. Here's the chromosome test. Here's the test on how many are alive and the number of them, which leads me to my next thing. We don't just fall under guidelines from the Colombian government. We also follow under guidelines from an international society for stem cell therapy. And it actually says that 80% of the cells need to be alive at the time of application. We don't do anything under 90% viability. So our viability, or the number of alive cells that patients are going to get, are automatically higher than international standards. And we also always overdose. Now, what I mean by overdose, it sounds like a bad word when you're talking about applications of anything, but overdosing in stem cells is not really a thing. Remember, we used to have billions more than we have now. And we're talking about, well, we need to maybe put 150 million in there. We may give you 160 million or 170 million to make sure that you have enough to actually overcome the problem. You can't be overdosed, but you can be underdosed. So people who think, well, I went and got stem cell therapy, but remember, if you got it anywhere else, it was probably maybe only 1 out of 10,000 cells could have been a stem cell. Maybe it was less. So maybe if I was going to have you buy a car from me and I just gave you a hubcap, that wouldn't be a car, right? There's a lot of other parts. We make sure that people get enough of a dose to have the best chance to get the therapeutic outcome that they're looking for. If you get underdosed, it may not be successful. So these are all of our quality control factors. Now, remember, we use 150 million verifiable, alive, robust, healthy, young source stem cells. They have the characteristics of a young baby when they're fast, when they can produce a lot, right? So we give a huge dose. And we can successfully use these for COPD, for Parkinson's, for type 1 and type 2 diabetes, multiple sclerosis, arthritis, cardiovascular disease, liver and kidney, autoimmune, and I really need to add in long COVID, or people who are suffering from the after effects of the COVID virus. There's a lot of different studies out there now that show that we can help. For orthopedic applications like plantar fasciitis, shoulder pain, hip pain, knee pain, etc., it's a high dose of 50 million cells. Most people that have gotten a regenerative medicine product in the States, it's usually only about 1 million cells, and they're frozen. Think about the difference of having 50 times more cells and them being alive instead of being frozen. Same kind of things for our anti-aging or cosmetic type of treatments is a large dose of over 50 million cells. So here's the thing. We're nearing the end of this call, and I really want to once again say thank you so much for showing up. If you decide that you have an interest of knowing more, we'd like to and get all of the questions that may have come up answered. We'd like to do a personal consultation. The consultation will just be informative, just like this call. It'll just be informative. We'll be able to ask you questions about your problem. You'll be able to ask us any questions that you have. If after that call, you're like, I would like to know if I'm a candidate, we would send you over a link where you can safely submit your medical history on a HIPAA compliant server, where it goes directly to Dr. Natalia and our medical team. They will review your case specifically and the different diseases you have specifically. They will research it from our own case files, our patient histories, as well as from other labs and studies from around the world. Based on what they find, they'll come back with a medical recommendation. Are you a candidate? Are you not a candidate? If you are a candidate, are you a great candidate, a good candidate, a fair candidate, or a poor candidate? And then they'll also give a an estimate of the number of cells and how they need to be applied. We're very conservative. We understand that you'll have to travel for this. So we want you to know with a very honest and open estimation, what we call a prognosis of what you should be able to hope for, all right, and expect. And then of course, there is the people who get a much better result than we actually usually tell them. If you want to do it at that point, we'd answer any other questions that you have. And we'd then help you book your stays, book your transportation with our concierge who will be there, who's bilingual to help you out, set up trips and tours if you want to check out the local area, and get you back to and from the actual medical facility. So once again, I want to thank everybody for being here. If you have a question, you get with the doctor's office that sent you, get with however you got here. If you're talking to one of our representatives, they'll get with you. We'll schedule you this personal call. It'll be only an informative call to answer your questions and for us to see if this may make sense to explore further. Once again, thank you so much for your time. I look forward to speaking to those of you that want to meet with me or speak with me in the next couple of days. Have a great day. Have a great rest of your day, and I'll talk to you soon. Once again, thank you for joining the call.